What's going on, CHP fam? Today we're going to be talking about squats, and specifically we're going to be talking about the version of the squat that we teach a lot of our patients that come to see us for things like lower back pain, maybe some hip discomfort or stiffness. And the reason we're going to coach it in this way is because when you walk around any gym, you'll often see what I would call a hinge squat being performed. Now, I call it a hinge squat because when a lot of people perform a squat in this way, the initial movement looks like we're hinging at our hips. So the squat starts and the first movement is this instead of this. So the first thing we want to see with a squat is the body lower straight down, almost like we're in an elevator. However, in this version of a squat, we often see something like this occur. And that's not necessarily a bad thing if it's used in the right situation. So that version of a squat's really popular in a sport like powerlifting, where the object is to lift the most weight possible. When you perform a squat that way, you're going to compress a lot of the lower back and you're going to stiffen up the hips, which is actually a good thing to lift the heaviest thing possible because you don't want to be sort of loosey-goosey underneath a weight. However, if you have a cranky lower back, maybe some hips that tend to bark at you sometimes, or you just want to be a little more mobile, that's not going to be the best strategy for you. So here at CHP with a lot of our rehab clients, we teach a squat where we're focusing on keeping our hips underneath us, where we're a little bit what I call stacked with our pelvis tucked underneath us slightly. And it's almost like our pelvis, our rib cage, and our head are all like three balls of a snowman, one on top of the other. And we teach it oftentimes with our heels elevated on a ramp such as this one. Now, you don't need a ramp like this at home. You can simply take some books, put them underneath your heels. And the reason we do it with a ramp or a heel lift is because it actually makes it easier to keep our hips underneath us for the entirety of the movement. So in this version, I'm going to stand on the ramp like so. And the reason, again, we use a ramp is because it's almost like I'm facing downhill. And when I'm facing downhill, I don't really want to fall on my face, so I'm going to shift back to keep my weight on my heels, which is going to allow my hips to stay tucked underneath me to a greater degree and allow me to feel my abs holding my spine up, which is going to be great for lower back health. Now I'm also going to hold a kettlebell right here, and the kettlebell is going to pull me forward even more to force me to shift back for many of the same reasons that I described previously. Now I'm going to tuck my hips slightly, like I'm rolling my belt buckle towards my face. I should feel my abs holding me up. And from there, I'm going to breathe in on the way down. Then I'm going to exhale on the way up. So I'm tucked. I should feel this. Breathe in on the way down. Exhale on the way up. Now, what we don't want to see is this being the initial thing that starts the movement. And then we go. I want to see this stay underneath, and the first movement should be your knees bending. Give it a shot.